Let's have a look at the rubber dam armamentarium, and later we will discuss everything in detail. First of all, the rubber dam clamps. We have different kinds of rubber dam clamps here. We will be talking about it in detail. It is the clamp which holds the rubber dam sheet in place during the treatment. They can be winged, wingless, stainless steel, matte, black clamps, gold coated clamps. We also have the tissue retractors, the Brinkers, and also different kinds of retainers. The additional retention is generally achieved with the help of dental floss or with a small piece of rubber dam sheet, wedges. Different kinds of wedges also help us with rubber dam retention. Now look at these sheets. We have rubber dam sheets available in various thicknesses from thin, medium, heavy, extra heavy, special heavy. We have it in the form of rolls of rubber dam sheet which are available in all thicknesses. They can be pre-cut in the form of sheets which are meant for pedo patients, that is 5 by 5 inch, or the adult size, that is 6 by 6 inches. They come in different colors, and the requirement and the choice of colors depends mainly on whether you are using it for documentation or for a pleasant working environment. This is an Insta dam over here. This helps in quicker placement of rubber dam sheet, very useful for aesthetic procedures and bonding. Then we have the wedges. Wedges can be of various thicknesses depending upon your requirement. It is always better to have different sizes with you. Then we have the rubber dam frames. Now this is the most commonly used metal Young's frame which is available in both the sizes, adult as well as for a kid. This is your frame meant for, this is a plastic frame, and the advantage of this frame is that it does not create a radio opacity when used during the x-rays. We have the articulated frame or the foldable frame, the hinged frame, and that is a template. The template shows all the specifications. If you look at it in detail, it has the punch marks both for pedo patients, that is the deciduous teeth, as well as for the permanent teeth, that is for the upper jaw, this is for the lower jaw, the upper right, left, lower right, left quadrants. Then you have the Brinkers, tissue retractors. Now, coming to the punches, you can see that I have two pairs of Ainsworth punch over here with a rotating table. And then of course the forceps. It is the forceps which carries the clamp with the rubber dam onto the tooth and engages the tooth. And then you have additional methods of retraction, that is your Teflon. This is an autoclave Teflon. Teflon can be converted into a thin roll, and this can be an excellent method of tissue retraction because it is very soft, very gentle and very smooth. So this is how you convert your Teflon into something like a retraction cord. This can be then placed with a retraction cord instrument. Plastic filling instrument is used mainly to dislodge the rubber dam sheet off the wings of the clamp to tuck onto the tooth. So this in general also has the rubber dam napkin. The benefit of the rubber dam napkin is that this acts as a barrier between the patient's skin and the rubber dam sheet. Those patients who are sensitized to latex can be protected with this. So the longer is their exposure to latex, the greater are the chances of developing sensitivity. This can be minimized significantly with this. The rubber dam napkin also absorbs saliva and any kind of moisture. The rubber dam napkin also prevents chronic irritant dermatitis which can develop due to constant contact with rubber dam sheet. Excess saliva which flows along the corners of the mouth can be wiped with cotton, or we can just engage a tissue paper. A tissue paper can also be cut in the form of a rubber dam napkin and placed as a barrier between the rubber dam sheet and the patient's mouth. So this is a summary of all the rubber dam materials that we would be needing for performing a rubber dam application. We will now talk about it in detail. Let us begin. So now let us have a look at the rubber dam sheets. The rubber dam sheets are the only consumables that we would need in the initial investment. Rubber dam sheets can be of different kinds. They can be available in pre-cut forms. For adults, a 6 by 6 inch, for children 5 by 5 inch, and they also are available as rolls for bulk use. The pre-cut sheets are available in various thicknesses: thin, medium, heavy, extra heavy and special heavy. They are all at a difference of 0.05 millimeters thickness from each other. Rubber dam sheets have two surfaces. They have a matte dull surface and a shiny surface. This is noticeable in all the sheets. This is the dull surface and this is the shiny surface. We also have textured rubber dam sheets. If you observe carefully, they too have a shiny surface and a dull surface. The shiny surface always faces the patient and the dull surface always faces the operator. Rubber dam sheets can be of the latex and the non-latex variety. Patients who are known to be allergic to latex or who are known to have any kind of allergies, it is always better to be careful and use non-latex dams like flexi dams. There are rubber dam sheets which are autoclavable. They are autoclavable at a temperature of 121 degrees Celsius.
Hello everyone, here's a quick video on rubber dam clamp placement on a mandibular molar clamp. I have chosen a passive clamp and let me go ahead with trial of the fit of the clamp. If you can see, my clamp is fitting passively at the cervical margin of the tooth. I check for its mobility and now I'm ready with my clamp. My next step is also to check the buccolingual fit of the clamp and the 4-point contact. Once I'm sure that it is not extending too mesial or distal beyond the tooth, I have chosen my clamp. For example, if I choose an active clamp, you can observe here that the jaws of the clamp will go deep down, closer to the gingiva and hold the tooth even more firmly. Now I take my passive clamp. It's time to place the floss on the clamp for additional protection. The floss is inserted through the jaw hole. Carefully observe that when we do the floss tie, we insert it through the lingual jaw hole first. The folded end is tied into a knot. Once we have tied a knot, it is gently slid distally closer to the bow of the clamp. Once it is moved distally closer to the bow of the clamp, it is slowly wound around the bow, gently yet firmly sticking to the bow. Once we have wound it around the bow, it comes down to the buccal side, the buccal jaw hole. Pass it through the buccal jaw hole and hold it firmly. Now we have tied the floss around and it is ready for placement. Select your rubber dam sheet, punch the hole and now mount the rubber dam sheet on the clamp wings. Here you can see me mounting the sheet on the central arm, the central wing of the clamp. It has been placed over the tooth with the help of the forceps. Engage the forceps into the jaw hole and carry it gently over the tooth. Once it has been placed, the next step is to reflect the sheet which had been mounted on the jaw of the clamp. When you reflect the sheet, the clamp is freed from the sheet and the sheet goes in and tucks under the central wing directly to the tooth. You can see that in the picture. Now repeat the process on the buccal side too. Reflect the sheet off the clamp. The reflected sheet goes off the clamp and gets tucked under the wing to the tooth. And that's how we get a good seal. Ensure the stability of the clamp. Make sure that there are no extensions or flows of the rubber dam sheet anywhere. If required, you can also use a liquid dam for better seal. The clamp is now in place. The free end of the floss can be made to fall off the cheek, or it can be tied to the rubber dam frame for better stability. Thank you.
Now we are looking at the Brinker's tissue retractors. Clamps are also called as tissue retractors because they help in retracting the gingival tissue, causing minimum trauma to them. As you can see, these clamps are gentle, they have smaller jaws, but they have a stronger bow. The reason being, when you compare the bow of these with the regular clamps, you can clearly see that although their jaws are delicate as compared to these which have stronger jaws, they do have much stronger, thicker bows for retention. As when the jaws are delicate, something has to be present to compensate and to add strength to the clamps, which is missing over here and is compensated with strong jaws. Brinker's clamps are excellent for tissue retraction and hence very useful in class 5 cervical cavities. Because of their delicate nature, generally they require additional retention with supplementary clamps, as we will see in the demonstrations. Let's have a look at the rubber dam forceps. The rubber dam forceps is used to engage the rubber dam clamp, the jaws of the rubber dam clamp, and carry it and place it in the patient's tooth. Let us understand the forceps better. The forceps has several parts. This is the handle which is used to expand the forceps arms. The forceps arm, if you observe carefully, has tiny beaks which help you in engaging the clamps and releasing it at the right time. This is a sliding ring which is near the hinge. So once you have engaged the jaws of the clamp and expanded the clamp according to the dimensions of the tooth, you can lock it with the help of the sliding ring and then carry it into the patient's mouth as it is and engage it into the tooth and release it. Both the forceps as well as the punch are autoclavable up to a temperature of 132 degrees Celsius, but they do not require frequent autoclaving. Let us have a look at the rubber dam punch. The rubber dam punch that I have here is Ainsworth punch, and this punch has a rotating table and a single plunger. This rotating table has multiple small holes. These holes, if you can see carefully, the smaller holes are for the lower mandibular incisors, the upper maxillary incisors and canines. The next one can be used for the premolars as well as the canines. And then we have the holes which are indicated for the mandibular molars, maxillary molars and the largest molar. So we have to choose our hole according to the size of the tooth. Once we get an idea how to get the dimensions of our tooth, punching a hole becomes easy. One important thing that we must note while punching a hole is that we should always ensure that the plunger falls perfectly in place into the punching hole. That is when we get a perfectly punched hole of a perfect dimension. With a perfect punch, you can see that the punched rubber settles down in the hole of the punch. Proof dena? So, if you see, this is a perfect punch and the punched material has settled down inside the rubber dam hole, and this has to be removed. If it doesn't settle, then probably the alignment of the rotating table with the plunger is not perfect, either due to some rusting or lack of balance in your rotating table, or we've been in a hurry to set the plunger right in place. One very important thing when we punch holes is to note that there should be a minimum distance of 5 mm between two punched holes. Let us note how to know it approximately and also what would be the consequences of not punching the holes at an average distance. The distance between two holes can be easily confirmed by placing any instrument handle between that, and that will give you an assurance of the distance. Let's punch the holes. And when you place it, can you see that they are uniformly distanced from each other? There is absolutely no folding of the rubber dam sheet in between the two holes. Suppose we would have punched them too close to each other, what would happen? This has been punched too close. Let's see what happens. If you notice carefully, the sheet is pulling away from the tooth, and hence you will not get good moisture control and good fit of the rubber dam sheet. Now this one has been placed further than 5 mm. Let's see what happens. So if you observe closely, there is folding. If I were to push this, there will be folding of rubber dam sheet.
When a lateral incisor is placed out of alignment from the rest of the teeth, it is important for us to punch the hole accordingly. This is a demonstration of the same. A minimum space of around 5 millimeters has to be maintained between each punched hole for the teeth. While placing the clamp or retainer for anteriors, make sure that it does not interfere with your working hand.
I have chosen a molar clamp for my patient. This is a festooned clamp and this is an active clamp. As you can see that the prongs and the jaws are directed gingivally and they are not facing each other. It's a festooned clamp and it has two arms, the central and the anterior, and it is connected by a bow. We are now going to mount the floss. Yeah, and carefully. Now I'm sliding it towards the bow and now I will wrap it. Wrap it as close as possible. Yes, we have come to the next bow. Now we will repeat the same thing here. I have my floss mounted clamp ready. We always start from the lingual and come to the buccal. I have my ivory forceps. The benefit that it engages the clamp and there is absolutely no movement of the clamp once it is engaged into the forceps. Okay, now let us try it in the patient's mouth.
let us have a look at a quadrant isolation from the lower mandibular molar till the canine. I'm using a festooned winged clamp for the mandibular molar. We will mount the clamp onto the rubber dam sheet where the holes have already been punched using a template. Now it's ready to be placed in the patient's mouth. The clamp is always placed from the lingual onto the buccal. Once it is steady, the sheet is reflected off from the wings and tucked underneath onto the tooth for a good seal. Once this is done, we will carefully reflect the sheet onto the rest of the teeth. It is always useful to train your assistant to support you during multi-teeth isolation as well as routine rubber dam isolation for a single tooth. Once complete, we will use additional sources of retention. This is a demonstration for placement of floss ligature. Floss tie is very good for retracting the gingiva to the maximum possible extent to expose the crown of the tooth for a procedure, especially like a class 5 cavity. It also gives excellent isolation. The floss is gently tightened around the cervical part of the tooth. This is also a very good source of retention. The free end of the floss is trimmed to ensure it does not interfere with the work procedure. The margins of the dam are inverted at the cervical part. This is the air inversion of the dam by blowing air gently and tucking it in with a simple instrument. Demonstration for additional retention using a piece of the rubber dam sheet. Simple and economical. Let's have a look at the split dam technique. The case was referred for a retreatment in a lower 4-6. The crown was removed and the tooth was taken up for retreatment. I opted for split dam because 4-7 was a sound molar and was good for clamping. So I have already tied the floss around the clamp. I have chosen a serrated festooned winged clamp. I'm loading the rubber dam sheet on it, and now I shall carry it with the forceps into the patient's mouth. Let's have a look at the oral cavity before we place it. You can see that 4-6 is devoid of crown. The temporary dressing, which probably the previous doctor has given, is in place. Now I'm placing my split dam. Yes, the clamp is in place, first from the lingual and then onto the buccal. Hold the floss firmly while you're performing the maneuvering. Gently lift off the rubber dam sheet from the wings and tuck it underneath. Check the stability of the clamp. And now pull the rest of the sheet over to the premolar ahead of the tooth to be treated. For better clarity, I am stabilizing the rubber dam sheet with rubber dam frame so I can see better. I have used a simple cord for the purpose of retention at the premolar end. Now it's time for me to place the liquid dam and seal the exposed areas around the tooth I will be working on. It's important for us to keep the cord short and trimmed so we have good access to our working area. These videos were made at the time of work and they were made very quickly. Yes, now after rearranging the rubber dam sheet over the frame and placing the liquid dam to seal the areas which were open to the oral cavity, now we are ready to work. The dressing has been removed. So this is one of the methods of applying the split dam technique.
Now let us have a look at the different kinds of clamps. We all know what is a rubber dam clamp. A rubber dam clamp is the part of the rubber dam kit which actually carries and retains the rubber dam sheet around the tooth while we do the procedures. Rubber dam clamp basically has different parts. Let us try and understand the different parts of rubber dam clamp. थोड़ा focus करना. What you see here is a winged clamp. A winged clamp could be a festooned clamp or it could have simple wings. In a festooned clamp, you have two parts, that is the central arm and the anterior arm. This major portion what you see is the jaw of the clamp. There is always a hole located in the jaws of the clamp and it has 4 prongs which coincide with the line angles of the tooth, the sharp ends of the jaw. Both the jaws are connected by a bow, and when you use a wingless clamp, you will always notice a sign W written in the clamp marking that indicates wingless clamps. You can clearly see that it does not have wings. Otherwise, it has jaws, it has 4 prongs, and it has a bow connecting both the jaws together, and there are holes in individual jaws. Another thing that you would notice is that over here we have 2 types. The stainless steel clamps and you have the matte clamps. Stainless steel clamps are good enough, but the matte clamps will make sure that it gives you a pleasant working environment, especially to the eyes when you work for long hours, and also does not create a shine at the time of documentation. We can function with 3 basic clamps, that is the molar clamps, the premolar clamps, and of course the anterior clamps. In some conditions, we don't even have to use the anterior clamps. Now you can see that these clamps here of a specific kind have color coding. The benefit of color coding is that you can identify the color with the type of clamp that is being used. For example, this clamp 2A, as the color coding says, is a universal maxillary bicuspid clamp. Similarly, this clamp 14A is a molar clamp for partially erupted or irregularly shaped teeth. The clamp 13A is a left mandibular molar clamp with serrated jaws. If you can see, the jaws are serrated for better grip on partially erupted teeth or badly broken down teeth. This, of course, is a double board anterior clamp. It's a universal anterior clamp. All the clamps are mounted on a clamp plate, which is generally autoclavable.
In this video, let us see how to secure floss on clamps in different ways. The first 2 methods would be to secure floss on the jaws of the clamps, and here we will be mounting the floss only on one jaw, the jaw which faces buccally, by tying a simple knot. The length of the floss needed is already been shown, demonstrated. A simple knot is tied. The same thing can also be done by tying a floss on the bow. This would be the second method of tying the floss. Again, this simple knot would be tied on the bow and placed buccally, the free end of the floss would be taken buccally, extraorally, and placed outside. It helps to tie the free end of the floss to the rubber dam frame. The other two methods would show how to envelop the floss around the jaws and the bow. When we do this in the first method, as you can see, the first knot is always tied on the jaw, which is placed lingually. So we secure a knot after folding the floss. Once we secure a knot, we gently slide it closer to the bow. Yes, it is closer to the bow, and now we envelop the free end of the floss around the bow, adapting it closely to the bow so there are no free ends which could get entangled either in our instruments or anything else. You can see that it is being adapted very close to the bow, no free ends, and then it is again secured with a knot on the buckle jaw, and the free end of the floss is released extraorally. A knot is preferred. Tying the floss on the clamp is preferably done before the trial of the clamp in the patient's mouth to keep it secure. Now another method of enveloping the jaw and the bow with the floss. It's pretty much the same except that there would not be extensive wrapping of the floss around the bow, so it saves a lot of time. And then we wrap it around the bow. Just a few turns, and then move it towards the buckle jaw and tie a knot around it. So the free end is again placed outside. You can tie it to the rubber dam frame. So these are the 4 methods how we can secure the floss around the clamps before placing them on the tooth. The floss is passed through the contact area and then folded onto itself and then pulled out of the contact area. This ensures that the sheet does not get pulled along with the floss and doesn't. One of the problems that we encounter is to slide the distal part of the rubber dam sheet into the distal interdental space in single tooth isolation. This can be easily handled with the help of a floss. Gently slide the floss into the space. Now generally the cusp of the tooth placed distal to the tooth in question interferes with the sliding of the floss. You can use a simple instrument to lift the floss off the cusp and into the interdental area, and from there on you can gently slide the floss along with the rubber dam sheet into the space. Once placed, carefully remove the floss without dragging the sheet along with it. Because if the sheet gets dragged with the floss, it could cut. The same process is repeated even in the mesial interdental space. Now my isolation is complete with rubber dam. I'm placing my matrix band, completing my pre-endo build-up. I prefer to use liquid dam whenever I feel that there isn't sufficient isolation. We just need enough liquid dam to seal the spaces where you feel there is a possible leakage. Excessive usage is not needed. let us see one clinical application of rubber dam. I have taken a medium thickness rubber dam here, and here I'm preparing it for an anterior 4 to 4 split dam. After making my markings on the template for the 4 on either sides, I have used a pair of scissors to create the slit. This particular patient came in with history of trauma to 1-1 and 2-1. 2-1 had a bulb exposure, and 2-2 the incisal part has chipped off. So I did not want to clamp or floss tie any of the teeth, and hence I decided to have a split dam from 4 to 4. The open space palatally was sealed with a remaining